So the next question I'd like to address is, how do I stop itching? So one of the most important aspects about itching and the fact that it's very common in PBC is that it doesn't always correlate with the disease severity. So some people who are itchy have advanced disease, some people who are very itchy have very mild disease. And so it's important to recognize that how itchy you are doesn't necessarily reflect how severe your disease injury is. Some studies have suggested that the itching gets better over time. Now, I don't know if that's because people learn how to control it, or the whatever started that process kind of calms down. But over time, some people do find the itching is more manageable. Outside of that, we have multiple agents that we can use to kind of help with itching. I will often try things that are a little sedating at night, because often the itching keeps a person up at night, and they have fatigue on top of the fatigue linked to primary biliary cholangitis, and itching is very disruptive for a person's quality of life. There's also a lot of over-the-counter creams that can be used. We'll recognize that Sarna, which is a tar-based cream, or sometimes like the oatmeal bath creams can help. Often I'll have individuals try things that have capsaicin in them. So the same type of an ointment that you might try for chicken pox or for a bee sting, or even like icy hot. The most important thing is to try to start experimenting. We recognize that the itching is sometimes more common after like you're hot or moist. And so although we don't want you to compromise your hygiene completely, being careful with how often you're showering, and trying to make sure that you stay nice and moisturized after you do take a shower is often very helpful. So we hear you. We understand that the itching is a significant complication of primary biliary cholangitis, but work with your clinician, because there are multiple agents that we can use, either prescriptive or over the counter, to help control that.